Hi, I'm Dr. Christina Martinez. I'm going to guide you on how to administer the stool test. So your doctor either gave you a doctor's data stool test or a GI map stool test, and I'm going to go over each one. But for both, what you want to remember is that 3 days before administering either test, you want to stop all antibiotics, antifungals, and antimicrobials that might interfere with the results. And then 2 days before administering either test, you also want to stop digestive enzymes, acid blockers, probiotics, laxatives, and any bismuth product like Pepto-Bismol. And then any other supplement or medication that you're on, go ahead and continue as you are taking as now, unless your doctor otherwise directed you. Okay, so for the doctor's data stool test, first you want to make sure that your kit has all the components necessary. Okay, so I'm going to go through those with you real quick. You want to make sure you have a requisition form, and you want to make sure to fill out section 4 and 5. And I'll go over this at the end as well because this is so important. They can't process the test unless this is filled out correctly. So just make sure all of patient information is filled out, and then you sign that, and then your payment information also needs to be there. And then just one little section in number 3, we will fill it out mostly, but you just need to put the date the final sample was collected because only you'll know that information, okay? So you have your requisition form, you have your instructions, and I'm going to be as thorough as possible, hopefully, but go ahead and read all your instructions. It'll just reiterate everything that I just said, okay? Then you're going to find a day 1 Ziploc, your day 2 Ziplocs, your day 3 Ziploc, 3 collection containers, your polar ice pack, your FedEx envelope with a billable stamp, and of course your box that everything came in. Okay, so you're ready to collect your first sample. You're gonna collect your first stool specimen in the container provided. You're gonna take your day 1 Ziploc, take the vial, you're gonna unscrew the black capped vial that's inside, and you're gonna use the spoon that's attached to collect part of the stool sample, fill up the vial until the very top line. It's labeled for you. Close really tightly, and then shake vigorously for 30 seconds. Really important, okay? So once that's shaken up, you also want to make sure that your vial is labeled with patient name, date of collection, and your date of birth. And it's really important that every vial has that information on it or they can't process them, okay? So I'm going to be kind of repetitive about that, but make sure it's labeled. After you shake it, put it back in its Ziploc bag, and this one goes back in the box. It's fine at room temperature, okay? Day 2 comes along, time for your second stool sample. Day 2 is going to be bound by a rubber band because it actually has 2 Ziplocs. It has a black capped vial just like day 1. You're going to do the same exact thing. You're going to collect your stool sample in one of the containers. You're going to unscrew the black cap, use the spoon provided, take stool from the sample, put it in the vial. Kind of self-explanatory. Then you're going to shake the vial for 30 seconds, put it back in the Ziploc, and then this goes in the box. Okay, on day 2, you also have a white capped vial. You're going to fill it up with stool just like you did the other vial, but this one is not shaken. And you're going to put the polar ice pack into the little pouch provided in the back of the Ziploc bag for this one. Okay, and then this one goes into the freezer. The white cap vial has to be frozen, okay? So this one's in the freezer. Day 3 comes along, time for your third sample. You're going to collect your specimen in the container provided. Take your day 3 Ziploc. There's 2 vials in the day 3 Ziploc, and they're both collected exactly in the same way, and they're both shaken for 30 seconds and put back in the box, right? So you have a black vial in the day 3 and a yellow vial in the day 3. And you're going to fill them up with stool just like you did the other vials. You're going to shake both of them vigorously for 30 seconds, and they both go back into the Ziploc, back into the box, also at room temp. Again, just another reminder, every single vial is labeled with your name, date of collection, date of birth, okay? So you're all done with your collections and now you're ready to ship. So it's best to ship within 24 hours of your last collection. The vials that were in the box were all at room temperature, and the white vial is taken out of the freezer, also put in the box with the gel pack, and then sent away. If for whatever reason you're not sending it within 24 hours of the last collection, go ahead and put the room temperature vials that are in the box in the refrigerator. And they can be up in the refrigerator for up to 7 days before you send them off. So this might be important if it's a holiday or a weekend, or if you don't have a bowel movement every day and it takes you up to 7 days to collect, that's fine. Just put them in the fridge. So once you're all ready to ship them, you're gonna take all the vials in their Ziploc bags, make sure they're labeled. You're gonna put the requisition form that's all filled out also in the box. You're gonna close the box, and then the box goes in the FedEx envelope that is provided. And then there's a billable stamp here that you kind of slap this on and it's all ready to go. You want to take it to a FedEx drop-off location, or you can just bring it here. We'd be happy to ship it off for you. If you have any questions at all, don't hesitate to contact our office or contact your doctor. And good luck. Happy testing. Bye. So now I'm going to go over the GI Map Stool Test. So before you start, make sure your kit has all the components necessary. Make sure it has a requisition form, and really important that you fill out the necessary parts of it. So patient information, make sure that that's filled out, and the payment information that's on the bottom left, make sure that that's filled out. We'll be in charge of everything else, except there's this little line on test information section that says date samples collected, and you'll be the one that knows that. So fill that out as well, okay? So you have your test requisition form, you have your instruction manual, and I'm gonna be as thorough as possible, but go ahead and read all of this before you get started. It'll reiterate everything for you, okay? You have one Ziploc bag, you have gloves, a yellow capped vial, one collection container, you've got your FedEx envelope and a stamp that goes along with it. Oh, it's already stamped for you. And then your kit. Okay, so you're ready to collect. Collect your stool sample in this collection container, and then you're going to open this yellow capped vial, and you're going to use the spoon that's attached to it to transport the stool into the vial. Make sure it's filled all the way to the top line and it's labeled there for you, okay? You close this really tightly and you want to shake vigorously for 30 seconds. Okay. Now, make sure that the vial is labeled with your name, date of birth, and date of collection. That's really important. They can't process it unless the vial is labeled, okay? So make sure it's labeled. You're gonna go ahead and put this back in Ziploc. And then this goes in the box along with your requisition form, okay? And this is what's gonna be sent out. You're gonna put the box in the FedEx envelope that's provided, and you can either take it to a FedEx shipping spot or you can bring it here. I would be happy to send it out for you. If for whatever reason you're not able to ship this on the day of collection, then go ahead and stick it in the fridge, and it can be in the refrigerator for up to 5 days before you send it off, okay? So just know that. If it's a weekend or a holiday, and you're not able to ship this within 24 hours of collection, stick it in the fridge, okay? I think that's it. If you have any other questions, don't hesitate to contact us or contact your doctor, and happy testing. Bye.